Well, everybody, welcome to Medicine and Science on the Pod TV network. I'm Nick Palavita. I'll be your host for today's program, but I will not be your subject matter expert because I am not a medical doctor. And so, with that, we're going to bring in our subject matter expert, who is a medical doctor, who's also board certified in internal medicine, to discuss what's going on, especially with RFK, who heads up Health and Human Resources, who is also not a medical doctor. So with that, Dr. Patmos will be joining us. And Dr. Patmos, maybe you can give us an update what's happening in our health centers, which are being now governed by a environmental attorney who is not really qualified in health matters, which I can attest to, who's running Health and Human Resources. So let us know what's going on in the Tower of Power of Washington, D.C.
Well, good morning to everybody. For those who don't know who I am, yes, I'm a board-certified internal medicine doctor with added qualifications in infection control and hospital epidemiology. Controlling infections is what I have been doing for nearly 50 years as a physician, and I still see patients. So this is in my sweet spot. So what's happening? Yes, he did it. He did what he promised he would not do. During the Senate confirmation hearings, Robert Kennedy assured the Senate that he would not change the childhood vaccination schedule. So what did he do? He changed the childhood vaccination schedule unilaterally, without consulting experts, without abiding by the established processes, without consulting even his hand-picked CDC ACIP committee members. He unilaterally changed the recommended childhood vaccine schedule in the United States. And as he announced this the other day, he said he did it basically at the direction of the president. It was the president who told him to copy other countries, that we were the outlier. Well, in fact, we're not the outlier. What they did was they copied an outlier. They copied the recommendations from Denmark, which recommends routine vaccinations against 11 diseases, whereas in the United States, we recommend vaccination against 17 diseases. Well, we used to. Now, the official recommendation is 11. Of course, all good doctors will just refuse to abide by these recommendations. So why Denmark? What was it about Denmark that Kennedy picked? Well, if you look at, and I shared some data this morning on LinkedIn, if you look at all the countries they compared, Denmark has the lowest number of diseases covered, and they're the outlier. The question should be asked, why isn't Denmark more like us, instead of why are we more like Denmark? And so why does this matter? Denmark has a functional, nearly perfect universal healthcare system where everybody has access to care. So, for example, pregnant women in Denmark are all screened for hepatitis B and followed up for hepatitis B. In the United States, 20% of pregnant women are never tested for hepatitis B. And of those that are tested, only a third follow up. So we have this fragmented healthcare system with enormous gaps and holes in coverage. It all depends on where you live. Many people in the United States don't have access to healthcare. And so that's where Denmark and the United States are very different. You could probably get away with fewer vaccines in Denmark. It's a small country, a small population, a homogeneous population with extensive safety net healthcare. We don't have that in the United States. We have 20% of children in the United States living in poverty who don't have access to healthcare. So that's why Denmark's recommendations don't pertain to the United States. This is a very bad decision. Let me just give you one graphic example of one disease that Robert Kennedy now says children don't need to be vaccinated for. Meningococcemia or meningococcal infection or meningococcal meningitis, unless you have personally diagnosed, managed, treated, and cared for a patient with meningococcal meningitis, you have no business commenting on this disease. If you have not seen meningococcal meningitis, you're in for a shock. It is one of the most horrific explosive infectious diseases, totally preventable by vaccination. But if you are not vaccinated and you get meningococcal meningitis, and it's random, it can just spring up, you have about 12, maybe 24 hours before you go from fine and healthy to dead. Let me give you a real world example of a patient that in a system where I worked, this is what happened. A baby came into the emergency room sick with a rash. It was a busy time of the year. It was very crowded. The ER was overwhelmed. It took a little bit of time for that baby to get back into, because it's just a baby with a rash, to get back into the ER, where the baby was finally evaluated, found to have meningococcemia. 24 hours later, the baby lost both arms and both legs. The baby survived, but has no appendages. That's meningococcal meningitis. And unless you know this disease, shut up. You don't know what you're talking about. Well, RFK has now said that children routinely now should be immunized against meningococcal meningitis and many others like rotavirus and hepatitis B and so forth. Now, he did maintain a recommendation against measles, but yet he has all of his people out there basically playing down the severity of measles and suggesting that, the vaccine might cause autism. So the rate of vaccination for measles and all other diseases in the United States is now plummeting. Most of the United States now is below the 95th percentile, below 95% coverage for childhood vaccinations. We are becoming a third world country from a vaccine standpoint. And what's happening? Measles is, at the end of 2025, we had over 2,000 cases of measles with at least 3 reported deaths. Remember, for every reported case, there's at least 1 or 2 unreported. So in reality, we probably had as many as 4, maybe 5,000 cases of measles. That outbreak began in the late summer of 2024 in Florida, which we talked about on this podcast when Dr. Joseph Ladapo, Florida's Surgeon General, told parents that they don't need to quarantine their children if they've been exposed. So measles spread from Florida to the southeast and now spread all over the United States. We now have over 2,000 cases of measles just in 2025 alone, and it's still roaring across the country. Influenza immunization rates have plummeted at below 50% now. Most people are not vaccinated against influenza, and we're having a horrible influenza season right now, worst in 30 years. We have had at least 7.5 million cases of influenza through the end of December, 81,000 hospitalizations, and 3,100 deaths. That's right. Just so far this season, 3,100 Americans, including children, have died of influenza. That's more death than occurred on 9/11, just to put it in perspective. So the United States now has this falling immunization rate. We're now encouraging infection in the United States. If you don't vaccinate, what that means is you're encouraging infection. We're encouraging people in the United States to give up their bodies and serve as a host reservoir for these diseases so that we can replicate, mutate, and disseminate them. So we are now a net exporter of disease. The United States has now exported measles to Mexico, which has killed children in Mexico. And we have now exported measles to Canada, where they're suffering with it as well. As I said, we have the worst influenza season in 30 years already. We have children dying from the flu in the United States. Pertussis is back. We had over 200 children die of whooping cough last year in the United States. That's a preventable disease. So I think you get my drift here. Things are really bad as Kennedy and his cronies on the ACIP are pushing down immunization rates. Diseases are returning, and it's happening right away in real time. This is not some hypothetical or theoretical consequence that might happen 10 years from now. It's happening as we speak. As soon as vaccination rates drop below that magic number of 95%, the diseases return, and vaccination rates are plummeting now. All of these actions by Kennedy and Malone and so forth are being interpreted by people as you don't need to be vaccinated. That's what they're hearing. What they're hearing is Vaccines are dangerous. We don't need them. And you shouldn't be vaccinated. It's all about your individual choice. Now, just a couple of quick comments about some of the language that Kennedy and Malone are using. There's this new terminology they've inserted into this whole discussion as if it's called shared decision making, as if, this is something new. What is shared decision making? It's called informed consent, and it's been what we do, what we have done. I've been a doctor nearly 50 years. We've always done informed consent. I learned about shared decision making and informed consent in the 1970s. That's where the doctor and the patient sit together. The doctor says, here's the facts, here's the pros, here's the cons, here's what I recommend. Of course, patient, it's your decision. It's the way we've always done things. Nobody goes up to you and holds you down and stabs you with a syringe against your will. Shared decision making is always what we do in medicine. They've used this new terminology now, like this is now going to be shared decision making, as if that's a new concept or it's novel. It's not new and it's not novel. It's what we've always done. There's another thing floating around, this concept of medical freedom, where you must have a choice. Let me tell you something. If you drown a person with incorrect information, you pour over them a bucket full of incorrect information about a treatment or a procedure or a vaccine or a medication, you tell them all this negative stuff, and then you say to them, but it's your choice. What do you think they're going to say? They're going to turn it down. So when these people talk about choice, they're making it sound like they're giving a patient the only way choice is legitimate is if you provide accurate information. The anti-vaxxers don't provide accurate information. They're providing false information and then saying to the patients, oh, it's your choice. That's not choice. That's misleading people and putting them in a situation where they will choose to make the wrong choice. Let me tell you, I've been a doctor 50 years. I still practice medicine. I can pretty much convince a patient to do whatever I want them to do by how I present it. If I want to convince you to do something, I can present the information in a way that will probably lead you to agree with me. If I want to discourage you from something, I can present the information in a way to discourage you. So this baloney about choice is baloney. It all depends on how it's presented to the patient. When you bury a patient in misinformation, you can expect they're going to make the wrong choice. Finally, one last comment about the medical freedom movement. Dr. Malone is very famous for saying, if there is risk, there must be choice. Well, and he bases this on the bioethical framework and the principle of autonomy. And that is true. In bioethics, we all have autonomy to an extent. No one can force you to have treatment against your will, with certain exceptions and with certain caveats. Let me give you an example. If you have active tuberculosis and you're walking around downtown Los Angeles with active TB and you refuse to be treated, which is your right, you will be picked up and quarantined and put into quarantine until you're either treated or cured of tuberculosis or you die. Remember Typhoid Mary? She spent her lifetime in quarantine against her will. She had typhoid and there was no treatment for it at that time. The law for centuries has upheld the principle that public health outweighs autonomy. You can't walk around with a contagious infectious disease harming other people because it's your choice, because it's your autonomy. So autonomy, all these bioethical principles, autonomy, beneficence, non-maleficence, all have to be balanced against one another. There's a reason why seatbelts are mandated. There's a reason why there's lots of things that are mandated for public safety. And so mandatory vaccination for children to go to school is not a bad thing. And what they're doing in Florida now, where they have just outlawed all mandatory vaccination under the guise of medical freedom, is really just going to invite more disease into the United States. The United States is now becoming a cesspool of contagious infectious diseases, like a third world country. We're now exporting contagious infectious diseases. And I will now wrap this up with my final recommendation. I know this podcast has an international audience. It is now time for other countries to restrict travel from Americans who cannot produce proof of vaccination. Other countries now have to stop Americans from coming in because we are at risk of bringing disease, those of you who aren't immunized, of bringing disease from the US into other countries. It's time for other countries to restrict travel from Americans because too many Americans are unvaccinated. Well, how's that for a new year, for a start to the new year? Grim or what? Oh, I lost the audio there, Nick.
A good start to the new year, Dr. Pep. Let's put that. I did do some research on your colleague. I think his name is Dr. Robert Malone. Okay,
Yes.
I'm going to pick on him for a little bit because of his problem. And his problem is a major conflict of interest. He is apparently the owner of the wellness company, or his officer or director.
I think it's Dr. McCullough. Maybe Malone is too. I don't know. But I know
or maybe
McCullough.
it's McCullough. One of them are. They're part of this wellness company, but they have direct conflicts of interest that are not disclosed to the individuals. And usually, if you have a conflict, you have to disclose it. And apparently they have conflicts, I think, and they don't disclose it, which is really very troublesome why anyone would listen to them. And I think both of them had run into problems with their board certifications, Dr. McCullough and Dr. In other words, the anti-vaxxers have serious problems. In other words, they're bringing their own contamination to the table. But they have an audience. People are listening to them. I listen to the people that listen to them. But the other problem is that they're wrong. I mean, it doesn't matter what they think. The flu spreads. It doesn't matter what they think. People are dying. And so what happens is they're creating a lot of mayhem, a lot of cases for their own personal interest. In other words, for their own pecuniary interests, as they would say.
Yes. To speak to your point, if I'm not mistaken, Dr. McCullough is the one who is involved with the wellness company. He's the chief medical officer for the wellness company. I believe he owns part of it, and he's profiting directly from selling ivermectin and hydroxychloroquine on the internet. Dr. McCullough is not board certified anymore. His board certification was stripped by the American Board of Medicine. American Board of Internal Medicine, because of his unprofessional conduct. So he was penalized, disciplined, had his board certification removed. Dr. Malone was never board certified. He's not even board eligible because he never did a residency. Dr. Malone's postgraduate medical education consists of 1 year of pathology internship. He didn't finish any accredited residency program, so he's not even board eligible. But he does have a major conflict of interest. One of his side gigs is he is the guy who serves as an expert witness in all sorts of lawsuits supporting the anti-vax position. For example, he was the prime expert witness in the case of the United States Navy SEALs versus the Biden administration. So he's a paid hired gun by the anti-vaxxers and works a lot of these cases. There's a lot of these cases, and he's an expert in all of them. And so he makes a fortune doing this. So yes, he has a huge conflict of interest, no question about it.
Mm-hmm. Yeah, and then they do tend to promote, at least what I've seen, they promote solutions that are repudiated by studies. In other words, ivermectin, hydroxychloroquine, I mean, just stuff that doesn't work. But they have today, more than ever, they have a big microphone because it heads from RFK all the way down. So what is it that's out there that people can trust? Because it looks like the current U.S. government, especially relating to health and human resources, cannot be trusted. So what should people do?
That's a great question. So I can tell you that physicians at large across the United States, all physician organizations are now telling patients, disregard anything coming out of Health and Human Services, FDA, and CDC. These agencies have been commandeered by people who have no qualifications, or worse, fabricated qualifications. So don't follow any of their recommendations. Where can people turn? They can turn to, I would recommend the Vaccine Integrity Project. It's CIDRAP, CIDRAP, CIDRAP. It's an organization that's headed up by Dr. Michael Osterholm, and they are now putting out recommendations around vaccination. You can't trust CDC anymore. There's nobody at CDC on the ACIP who has any clue what they're talking about. There's one infectious disease doctor on that committee, and he's completely overwhelmed by all the non-infectious disease people, some of whom don't even have legitimate resumes at all. But CIDRAP, CIDRAP, is where I think people should turn for their advice. I'm a physician. I am advising people, do not follow the advice from the CDC, ACIP, or from Robert Kennedy. They don't know what they're talking about.
Are there any other organizations or places that people can get legitimate information?
Yes, the American Academy of Pediatrics, still a go-to source for advice about what to do about your children. The Infectious Disease Society of America, they both have, American Academy of Pediatrics has a website. Infectious Disease Society of America, IDSA, is a go-to source for information about infectious diseases. It is what doctors rely on. We go to IDSA for information, and their website is available to the public. CDC still has some good information, but the problem now is that CDC is just been infiltrated. The director of the CDC, this guy O'Neill, has no training at all in biology or science. He's basically a Trump appointee, and he's ramming through whatever Trump and Kennedy say. What's really scary, and you alluded to this, is that it's not this that Trump is this dangerous and Kennedy is this dangerous and Malone is this dangerous. It's that there's these millions of people out there who think this is great, who think that what they're saying is right. You look at some of the comments on social media, and people are cheering what Kennedy is doing. It's ridiculous. We have a very significant percentage of the population of the United States who believe that which is incorrect and untrue. And the politicians are pandering to them. The anti-vax movement in the United States is enormous and powerful and dictating public policy now through their voices of Trump and Kennedy and Malone and McCullough. It's really the fact that we have this huge anti-vax sentiment in the United States that's just been allowed to grow and develop, and it's now huge. I mean, maybe as many as a third, 40%, maybe up to 50% of the people in the United States now believe things that are incorrect about diseases and vaccines. Like, you don't need vaccines. You're just going to eat right. It's just about eating right and being healthy. And no, it's not. Viral diseases largely don't care how healthy you are. The Spanish flu killed 50 million people, mostly young, healthy men.
Yeah, you said also a couple interesting things. You said that Robert Kennedy unilaterally changed the vaccination schedule.
Yes.
How can an environmental attorney with no medical qualifications whatsoever unilaterally change the vaccination schedule for all children in the United States?
He did. He had a couple of his underlings do a study, and they pulled together a chart comparing countries and what vaccines they recommend and don't recommend. And they did this in a couple of days after Trump gave him a directive to do this. So they just, I think some of his underlings pulled together some crappy data, and the slides are right on LinkedIn. I put them on LinkedIn. Denmark is the outlier, not us. And they just basically, so it is written, so let it be done. The Pharaoh has spoken, and the law has been changed. And he didn't even involve the CDC, didn't even involve the ACIP, his own committee. They probably would have rubber stamped it anyway. But he didn't ask any experts. He just did it because he felt like doing it, because he can get away with it. Because if Trump can invade Venezuela, Kennedy figures, what the hell? I can change the vaccine schedule, and no one's going to stop me.
What wasn't it RFK? Didn't he say that people should not be taking medical advice from him? Wasn't that a statement he made recently or something like that?
Yes, he said, no one should be taking medical advice from me. And here he is giving medical advice. Why would anybody take medical advice from someone who's not a doctor? We're
Yeah.
going to get medical advice from Paulie Walnuts Galtieri on The Sopranos. I mean, you got to go to a doctor to get medical advice. We're going to get medical advice from people who are not trained. Kennedy's not trained. Why is he telling anybody what to do with on a medical topic? It's ridiculous. It's completely insulting to physicians.
Right. And last thing that you made a comment dealing with Denmark has universal coverage and USA has gaps. It shows up, at least on the internet, that Denmark has an extremely low poverty rate and has universal coverage. They're a whole different, small, very controlled country, as opposed to the US, which does not have universal coverage. And you're right, there's big gaps, and it's a whole different management system.
Yes.
Can you explain a little bit more why Denmark's vaccination schedule just will not work on the United States?
Exactly, because we have, see, in Denmark, everybody has access to care. So if something starts to happen, an illness pops up, people get cared for right away. They get treated, it gets controlled, it's dampened. You're not going to see as much widespread disease because their healthcare system is so good. We have we have the worst healthcare system of any industrialized nation, because for some people, we have good care. I have great health care. My wife and I have fantastic health care. We're Medicare Advantage, senior Medicare Advantage, Kaiser Permanente patients. We have fantastic health care, but not everybody is as fortunate as I am or as we are. 20% of the people in the United States are in poverty, and many people, millions, tens of millions of Americans have no access to healthcare. If they get an illness, there's nowhere for them to go. They only go to the emergency room if they're dying. And that means that they walk around with whatever disease they have, spreading it. Our dysfunctional, horrible, sorry excuse for a healthcare system is the reason why we need these vaccinations. Yeah, they can get away with it in Denmark to an extent because they have a much more thoughtful, comprehensive system where there isn't poverty and everybody has health care. We don't have that in this third world country that we live in.
All right. So I guess what we can get out of it today, which is really unfortunate, because the CDC used to be the gold standard. Notice I say used to be the gold standard of health. Now it's become a not trustworthy organization. And the USA, that used to be a leader in health-related areas, now maybe not even in the top 10 in the world. I mean, if you look at it, so it creates a real problem for the consumer, because they need to go to places where they can actually get good information from. And I'm glad you brought up some of these organizations, because I can tell you I'm not that familiar with IDSA, and I'm sure the rest of our audience isn't familiar with IDSA or Up to Date or some of the things that you bring forth to them, and look to get your information from different sources that are reliable, as opposed to the CDC, who has been co-opted by a group of people that have agendas and conflicts of interest. So we'd like to thank Dr. Patmos, who's board certified in internal medicine with added qualifications in infectious diseases, okay, which are important, and our audience in the United States, and of course our audience around the world listening to Medicine and Science on the Pod TV network. And we'll see you next week. Bye-bye.